Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Early stage toenail fungus symptoms and treatment. If your toenail has recently become thickened and discolored, you may be dealing with a fungal infection known as onychomycosis. You are not alone. These has been found to affect about 14% of people. You may first notice the edge of the nail looking thicker and more brittle before it spreads to the rest of the nail. /r/n/r/n This article will highlight the first signs of toenail fungus and discuss its causes, how to determine if you have it, early treatment options, and what happens if you leave it untreated. /r/n/r/n Alvarez Getty Imagesrnrn The early stage of onychomycosis may start as a simple, painless spot on the tip of the nail. That area of the nail may turn a color such as white, brown, or yellow. With time, this may begin to affect more of the nail. Also, residue may build up under the nail. /r/n/r/n The nail may also begin to pull away from the bed, and the top may become powdery. Over time, the nail may become discolored and thickened and may start to split and break down. Eventually, this may spread to the other nails. /r/n/r/n Mikhalitskaia Getty Imagesrnrn Toenail fungal infections are caused by various species of fungi, which flourish in heat and humidity. Fungi can also cause other infections, such as ringworm and athlete's foot. If your toenail has a crack or injury, you may be particularly susceptible. /r/n/r/n Some of the ways you may acquire toenail fungus include the following. /r/n/r/n However, not everybody who comes into contact with a fungal organism will develop toenail fungus. Some things that will make you more vulnerable include /r/n/r/n If your toenail is undergoing some changes, you may not be sure whether the changes are due to an injury or a fungal infection just by looking at it. /r/n/r/n If you recently stubbed your toe or dropped something heavy on it, you may be contending with a bruise. If there is a black area underneath the nail, that is likely what it is. But if the nail appears gray, yellow, or even greenish, then the likelihood is that this is a fungal infection. /r/n/r/n You may also want to check to see if the nail is still fully attached to the bed. If it has begun to separate, it may be a case of toenail fungus. /r/n/r/n To determine whether it's toenail fungus, a healthcare provider will take samples of the nail, the debris underneath it, and the nearby skin. These samples will be mixed with a special dye/stain and then undergo close examination with a microscope to determine what organisms may be infecting the area. /r/n/r/n A fungal skin infection, like athlete's foot, found in the surrounding area will often appear as nail fungus. /r/n/r/n To treat early toenail fungus, a healthcare provider will first trim away as much of the fungus-infected nail as possible, including clearing away any debris in the area. /r/n/r/n They will then prescribe medicine for you to apply to the affected nail every day or every week. The idea is to keep any remaining fungus from spreading so the healthy toenail has a chance to grow out over the next year or year and a half. /r/n/r/n Possible topical medicines, applied to the nail, you may be prescribed include the following. /r/n/r/n If you are prescribed one of these medicines, particularly one you must use less frequently, you may want to develop a system for reminding yourself to apply it so that it can effectively keep the fungus in check as the nail grows. /r/n/r/n It may be easy to dismiss toenail fungus, especially in the beginning. In the early stages, it doesn't cause pain and may be confined to just one part of one nail. But it's important not to forego treatment. If left untreated, it will likely spread, affecting more of the initial nail in question and also beginning to impact other nails and the surrounding skin. /r/n/r/n As toenail fungus gets worse, it can become more unsightly and painful. In some cases, it may even become painful to wear shoes. /r/n/r/n The condition also becomes more difficult to treat. Early on, topical treatment is the mainstay, but it may not be sufficient to eliminate the infection. Instead, you may need to take an antifungal pill such as diflucan, fluconazole, Grifulvin V, Grifulvin, Sporanox, itraconazole, or Lamisil, terbinafine, either alone or in combination with topical treatment. /r/n/r/n If the toenail fungus is severe enough, it may become necessary to remove the nail altogether, either by applying a chemical to the area or by surgically removing it. The nail can grow back, but the fungus may return as well. Your healthcare provider can also treat the area so that the nail will not return. /r/n/r/n Steps you can take to help avoid developing toenail fungus include the following. /r/n/r/n Detecting toenail fungus can be a little tricky in its early stages. It may resemble a simple nail injury, which will resolve on its own. But if it's toenail fungus, it may only get worse, expanding from a spot on just the tip to thicken and discolor more of the nail and detach it from the bed. /r/n/r/n This may be treated early using topical fungal medication. But if this progresses, then more aggressive oral treatment may be necessary. If left untreated, this may spread to other nails and even affect the surrounding skin. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.